Hi, this is our first interview with Rhonda on the adrenal insufficiency. Rhonda, can you tell us what adrenal insufficiency is?
Adrenal insufficiency is when your body cannot make enough cortisol, and the cortisol is made, you have to have cortisol in your body to be able to function, to be able to live. Every cell, every organ maintains your body temperature, your blood pressure, your heart rate. Comes from your adrenal glands. Your adrenal glands sit on top of your kidneys. You have pituitary glands up in your brain, and they stimulate ACTH, aldosterone, dopamine, all these natural steroids and natural hormones that your body creates for every day of living.
For just your everyday functions.
For everyday function, living, your every organ, every cell, every muscle, your whole body, your whole occurring
So
system.
it's a pretty important thing that people don't realize how important.
Yeah, it controls it in everything in your brain as well.
Right. So what were some of the symptoms that you were having prior to you being diagnosed with this disease?
I had really bad pain in my neck, going up through the back of my head, my lower back, and I would say I was a really good pain tolerance because I had an AVM in my left temporal lobe, so I was used to bad headaches and bad pain. And for me to say I'm a 4 or a 5, the average person would probably say they were at an 8 or a 9. I would say I felt like I was being mauled by a bear and dragged through the woods. The severe pain and the headache that came up behind my neck and up in the back, down my lower back into my legs, muscle spasms. I was very fatigued, very tired. Just to get a shower, I felt like I ran a marathon. I felt like I ran all around town. I didn't go nowhere. Just to go to my daughter's, ball game, to a volleyball game or a basketball game, that would wear me out. And then I would be down 2 or 3 days, and if I got sick, it took longer for me to feel better. It got to the point where I used to take my pain medication once every 2 to 3 months. I started taking it, or getting it refilled every 2 to 3 months. I was getting it refilled about every 3 weeks. My doctor also prescribed a second pain medication along with it, even though I was doubling up on the first one. Nothing was touching the pain. I changed mattresses, bought different pillows. It got to the point where I was taking 60 to 70 milligrams of melatonin with the pain medication just to try and sleep through the pain, and I would still wake up every hour and a half, 2 hours in severe pain.
So pain is a big symptom of it. What other kind of symptoms were you having?
I was thinking I was crazy because nobody was finding anything, and I was throwing up a lot. I would forget to eat. I didn't have an appetite at all. I always felt full.
So you had a lot of weight loss.
I dropped down to 89 pounds.
Wow.
And I would realize, oh my gosh, I didn't eat anything yesterday, and here it is 6 o'clock in the evening on the following day, and I still hadn't ate. And then I would just eat enough for a tiny little bit, and I would end up throwing up, or I had diarrhea, or one way or another it would come out. So then, I started, after seeing pictures of myself, and I thought, oh my gosh, like I can see every bone in my body, and I thought maybe that's why I'm hurting so bad. And I was diagnosed with fibromyalgia, so I thought, I'm having fibro attacks, but this fibro attack is lasting very long.
Mm-hmm.
And then I was also having spells of amnesia,
Mm-hmm.
where I forgot. We went to the movies on Christmas night, 2015, and just allowed somebody raise their voice at me and that put me into where I totally forgot the whole movie. I totally forgot the whole night, but I cried the whole way home.
And you didn't even know why you were crying. You were just crying.
I just cried, I guess, the whole way home. I didn't remember the night. I didn't remember Thanksgiving that year. I had my nephew's wife send me pictures to kind of remind me of bits and pieces. Then at the mall, my daughter and I were at Walmart, and then we went to Old Navy, and then we went to the mall. And the scary thing is, I drove from Walmart and Old Navy because, you know, everybody was Christmas shopping, holiday shopping, so it was pretty busy. And then we went to the mall, and I felt really lightheaded, and I thought, oh my gosh, I'm going to pass out. I need to sit down. And chugged my water, and all of a sudden, I didn't know where we were. I didn't know how we got there. So
was fainting one of the symptoms you were having?
Yeah, because my blood pressure was going very low.
Okay.
I was in the hospital with a PICC line going through with dopamine to keep my blood pressure from bottoming out. And then that was in August of 2015. And then in September 2015, I had fallen and went straight back and broke my lumbar 2 and 4, my tailbone, and whacked my head pretty hard off the kitchen floor. Ended up getting transferred to Erie, and then that's when I got the pacemaker because my heart rate wasn't going above, it was staying between 30 and 40 when I was awake. When I was sleeping, it was dropping in the teens. My blood pressure was running 60s over 40s. Sometimes I couldn't even get a reading at all. I had passed out twice after I hit the floor. My daughter, I was more like, you know, just put me back in bed because nobody was giving me answers.
Right.
And I had went limp in her arms, so within 10 minutes time I had passed out twice. And then I ended up with a pacemaker. If they would have checked cortisol levels from the beginning a few years ago, I wouldn't have gone through a surgery in July of 2015, removing all of my lower teeth because they were going bad from the bottom up, but they didn't know why. And then
so healing with this disease is also an issue.
Yes, I have knots where my internal stitches never healed. 2 days after the pacemaker, they took my gallbladder, thinking that's why I was having the back pain, and that's why I was being so sick. They were going to make me feel better. They took that. I still have stitches that fester up that I have a suture kit that I have to pull out. The stitches inside my mouth never healed.
So through all of this, leading up to your diagnosis, what were some of the other diagnoses they were trying to tell you? Like they took your gallbladder because it was inflamed, thinking that was something. They put a pacemaker in thinking your heart was the problem. What were the other diagnoses that you were given for reasons that you were having all these?
They said possible stroke. They, in July of 2016, June 2016, I had a heart attack.
Was this before or after the pacemaker?
This was after the pacemaker.
Wow.
I had a heart attack, and they had done thrombotic therapy. They caught it in my blood. My EKG came back perfectly clean. But then my troponin levels were raising, you know, by the hour, and they gave me, they immediately started thrombotic therapy, then followed by heparin therapy. And that's another thing, is any blood thinner kills your cortisol levels. Any anesthesia kills your cortisol. And anybody that has adrenal insufficiency should always have a bag of Solocortef or hydrocortisone. A bag of steroids ran through them prior to having any of this done.
Prior to any surgery, so that they don't have
Yes.
the depletion of cortisol.
Yes, and they should also stress dose before, which means
Increase their
your oral
oral dose.
hydrocortisone
Okay.
at home, because that's the only thing we have to replace the cortisol is hydrocortisone, and to replace the dopamine and the aldosterone to help regulate blood pressure, we're left with Florinef. And so out of your pituitary glands and your adrenal glands, all these 50 to 100 different natural steroids and hormones that your body makes and creates, autoimmune, everything. Like you get a cold and you have it, and it automatically signals something's sick and you got to get rid of it.
Mm-hmm.
You're unable to do that with adrenal insufficiency, and there is no cure for it. That is the treatment that you're left with.
Mm-hmm.
But when I had the heart attack 3 weeks later on July 3rd, I had ended up going back in through another heart attack. I ended up going to a different hospital because I felt like I didn't get answers the first time, so I'm just going to try a different hospital.
Right, you just keep having all these problems, but they haven't been giving you any answers to why you're having these problems.
Right. So then they ended up transporting me back to the hospital I had the first heart attack in, but they put a nitroglycerin patch on me, and they did give me nitro in the ambulance. And, I stayed alert. I was more alert with it. The heart attack wasn't as bad. My troponin levels didn't go up as bad, and, they immediately started running heparin again.
Mm-hmm.
And then July 5th, they did a heart cath where they went through my wrist to find out, if there's any damage to the heart, because they had done a stress test that came back normal. They still had no answers for me,
Mm-hmm.
And here it is almost a year later from the time I had the dopamine and everything in me, and the pacemaker was supposed to solve everything. They said my veins weren't contracting, and therefore it wasn't allowing the blood to flow through.
Mm-hmm. You have a picture of that, right?
And then during the heart catheterization, 2 main arteries were being shut down and not allowing blood to flow to the heart. So then that's what caused the heart attack. But
they didn't have a reason why that was happening.
No. And as soon as he put nitroglycerin in me, they opened right up.
Mm-hmm.
And you can see the pacemaker wires. You can see where my occluder is from my first heart surgery in 2010. And these 2 veins or arteries were the ones that were shutting off and not allowing the blood to flow through. But he said that he wanted me on nitro every night. I said I could not do that because my blood pressure will bottom out.
Mm-hmm.
I'm not only hypertensive, I'm also hypo, so I can go either way, and it's too scary to risk it. So I have to carry nitro on me. And they just called it spurt syndrome. I had the chest pain. My heart would go sky high. But when I went to the follow-up appointment, he said, you're having cardiovascular collapsation, but it's not vascular. And I said, then what is it? And he said, I don't know.
Mm-hmm.
You need to go to the Mayo Clinic in Rochester, Minnesota. And I said, that's 1,000 miles away, and I can't afford that.
Mm-hmm.
And it's my daughter's senior year, and they don't take my insurance. And he said, well, you better get different insurance. So I basically got fired by my cardiovascular doctor.
Okay.
I had went to the GI doctor that took my gallbladder out, asking him for a scope stat, thinking I had something wrong with me. I knew something was wrong with me inside. It felt like I was dying on the inside. They knew I was holding bad sodium and not good sodium. They knew that for some reason everything was fighting against my heart, but they just didn't know why. Nobody could figure out why.
Yeah, it's kind of like your body fighting against itself.
Exactly. It does fight against itself. And when I went to that GI doctor that took my gallbladder, he said, if I put you under, he said, I'm not going to put you under. He said, not like this, you wouldn't make it through. And I said, but you took me under less
take
than
the
20,
gallbladder.
less than 24 hours later, after I had a pacemaker put in, and I was weaker then. And he said, no. And he said, this is all too complex. So he fired me as well.
So then to sum it up, some of your basic...
So then I went to another GI and had the scope done. And then I also had speech therapy going on. I was choking. It started in March of 2016 where it really got bad. I was choking on liquid. I was choking on food. Anything, so then I got to the point where I felt like everything was stuck right in here. And
did they have a reason for that?
No. When I went and I had the scope done to another GI doctor, they just said mild gastritis, which is basically gas of the stomach.
Right, so they were basically treating you for acid reflux or whatever.
Yes, and they said that I had acid reflux, so to continue my protonics at night. There was shrinkage of my stomach. There was narrowing in 3 different places of my esophagus. They did not stretch anything. They did 18 biopsies. They all come back benign.
And that's a picture of that.
This is my esophagus. This is a normal esophagus. This is a normal stomach, and this was my stomach and how bad it shrunk.
So you can tell the difference very clearly.
Yes, and it was very, very irritated from most likely throwing up so much and not being able to keep anything down. It got to the point where I was on Insure Plus.
Yeah.
A lot.
So to sum it up, you pretty much were diagnosed with severe headaches, fibromyalgia. You were diagnosed with acid reflux.
Acid reflux.
The
RLS.
The RLS. And then
anxiety.
Depression.
The PTSD.
Also with the blood pressure problem.
Hypertension and hypotension.
Yeah.
Or hypo. And they just didn't know
what was going on.
Why.
Okay, so how did you find out that this could be what it is?
July 5th when they did the heart cath, and the heart cath went bad. The hospitalist that was working that night, there's only a 5% chance of it going bad and only a 2% chance of needing a transfusion. I fell in them numbers. But thank God that I did, because the hospitalist that night was looking over my chart before he even came in to see me. And he came in and he started talking to me about a blood transfusion. I told him no. And he went into the statistics on my percentages of it being bad or whatever. And I said 5% chance of going bad. 2% of even needed a transfusion. Give me what I need to build up my own blood. And he said, okay, I'll give you to 5 a.m. He went back out. He came back in. He said, have you ever had your cortisol levels checked? And I said, is it a blood test? And he said, yeah, it's a simple blood test. And I said, well, probably they take blood from me all the time. And he said, no, they do not check your blood. They do not check your cortisol levels unless you request it, or unless there's a doctor that is familiar with it. And I said, well, what's it matter? And he said, it matters bad. He said, my grandmother had Addison's disease. He said, in looking through your chart and looking back, he said, you have every sign, every symptom
of Addison's.
Of Addison's or some kind of adrenal insufficiency failure. So he said, if you give me permission at 5 a.m. when we do a blood count draw on you again, can we test for your cortisol levels? He said, and I will send it out to Erie. It'll take a week and a half to 2 weeks to get back. And I said, absolutely, yeah. Why not? And by the time I got him back, I was already home, and my primary doctor called me, and he said, Rhonda, your cortisol levels are low, very low. And I don't remember what the numbers were, because I was also having a lot of brain fog and, confusion and stuff. And he said that he was going to have the home nurses draw blood and have it retested again. And I said, okay. He called back a
Very
week
low.
after they did it, and he said, they're still low. And I said, now what? He said, I'd like to have it retested again. I said, and then what? He said, then I will refer you to an endocrinologist. I said, no, refer me now. Because the GI doctor, after the scope, he had said, you know, we'll wait 6 months till your heart gets under control, and then we'll do a colonoscopy and make sure there's nothing hidden up there. And I wasn't going to settle for that answer. I knew something bigger was going on. And I wouldn't have all the pain up through the back of my head and my neck if it was something down
Could do
in
with
there.
your colon, yeah.
You know, and I know it wasn't cancer because they, you know, they were testing my blood. Nothing was coming up. So I was originally scheduled for January 17th, 2017 to see the endocrinologist, and thank God for my primary doctor and a woman that works for him that just would not give up on me, and, you know, saying there's no way, you know, I would make it that long. And I knew I wouldn't make it. I started writing my wishes out on my phone. I thought, you know, this is it, because as of September 2016 is when everything progressed really fast and got 100 times worse. I had cried to my primary doctor, and I said, do I need to see a psychologist? Do I need to go to a shrink? Because am I crazy? You know, why would I block out these? Am I grieving the wrong way? Because I'd lost my mom, and I lost, you know, a woman that was like a grandmother to me, and then I lost my grandfather, you know, and all three losses that I was there for, like, within 2 years. And he said, no, it's not grieving. You're handling your grieving well. You're not crazy. There is something going on. And when so then after that, with them begging, you know, the endocrinologist, finally they ended up ordering an ACTH stimulation test.
And what is that?
That is a test where they put in, they draw your blood first. They put in an IV, and it's done at a cancer center, and it's a very relaxing setting. And it's a 2-hour test, and they put in an IV, and they do a blood draw first, and then they put in ACTH to activate your adrenal glands, and to see if they make any cortisol at all. And they have to do it at exact amount, you know, at the same time, and then they inject again, then they, you know, draw blood again, and they keep doing it. And it's about a 2-hour process. And that day, I was so out of it, I barely remember it. I did have to fast the night before, but I was allowed to drink water, and I was allowed to take my normal medication that morning. I just couldn't eat. As soon as the test was done, I was able to eat, but I had no appetite, so I really didn't care about eating. And then I was so exhausted just going a half hour away, sitting there for 2 hours in a very comfortable chair, and a half hour coming home, that I just came home and I went to sleep. They had called me that day, and the phone was right by my head, and I didn't even hear the phone ring. I called them back the next morning, which I had the test done on Thursday. I called them back on Friday, and they said, you need to be here Monday, 4 o'clock. And I said, okay. And they're like, you definitely have adrenal insufficiency. And I thought, finally.
I thought that was a relief, because now you know you got something that can be treated.
It was a relief. I cried. It was happy tears at the same time. It was fearful tears, because back in July, when that doctor had brought it up, I started doing my research.
Right. So you already knew what to expect if you had it.
Yes, I looked on the Mayo Clinic for their good sources for information. Cleveland Clinic, Vanderbilt is really good resources for finding anything like that. I wouldn't suggest Wikipedia, because I was dead.
Anybody can put stuff on Wikipedia. Yeah.
So, reliable resources. I did do all the research on it, and so I was pretty familiar with secondary adrenal insufficiency and primary and the different autoimmune diseases that run with it, and all the different diseases that can go along, with it. But at least I thought, finally I have answers, and they're going to be able to,
treat me. Yeah.
treat me and get everything together.
So, pretty much that shows how it affected you as far as knowing what it was. But then how has this disease changed or affected your life since you were diagnosed?
At first she told me, I want you to take 20 milligrams of this hydrocortisone, and within a half hour you're going to feel so much better. But don't go through running around cleaning your house and thinking that you can do everything. You got to stop and remember and think in the back of your mind, keep in your head that this isn't real. And when you're tired, even if you don't, you need to let your body rest, and you need to space it out. That's where I initially messed up, because when I did feel good, I thought, oh my gosh, there's no pain. For
That's amazing.
over 2.5 years, the pain was gone. But at the same time, I was like, I wore myself out. Thanksgiving 2016, I ended up falling, and I fell forward. The first thing you're going to do, you're going to
Put your hands out.
Hands down, and my walker kind of left me. So I ended up getting caught up on my wrists, on my hands, my feet, my legs. I didn't know what to do. Of course, my endocrinologist, everybody is out. So I ended up calling the Mayo Clinic, because they have doctors on call all the time. I did develop a hematoma on my wrist. I had my daughter milk it. They told me to use the Solocortef emergency shot. And because I had started stress dosing, knowing, all right, I'm not feeling well, I have to increase the hydrocortisone. She did tell me to avoid large crowds for a while, because the first year of diagnosis is the hardest, because you're the body's going to try to fight against it. Their body's going to say no, because the body wants to hold on to everything bad and get rid of everything good, and they're trying to replace that cortisol, and the body's going to be like, no.
You got to find the right levels to what your body's going to accept and function on.
And it's going to change a lot throughout the year. So the goal number 1, keep you alive the first year. Goal number 2, find out why this happened, why you have it, and it is genetic. I probably started out as secondary, and because it went so long without being found, and it then had turned to primary.
Right, because they were treating you for other symptoms.
Treating me for symptoms instead of finding out the root
cause
of the problem.
So the things they were treating you, the medications they were giving you for the symptoms of the other things, like the fibro and things like that, was medications that you shouldn't have been having as a adrenal insufficiency patient.
Right.
So it made things kind of worse. Yeah.
And all the surgeries, the physical stress, the amount of blood thinners, even ibuprofen, Motrin, all of those all have blood thinners in them.
Yeah.
And so they were kind of, that just kind of made everything, progress, especially after the heart attack and stuff. And then,
but being diagnosed has helped you in a way, as far as now you're better prepared. You know what to expect. You know what symptoms to watch for, things like that. Like when your body is saying, "Okay, I'm done." You know, or
I can feel the symptoms coming on. I know the symptoms of low cortisol, and I can feel them coming on. So then I know when I have to take my meds. I have to take a nausea pill 15 to 20 minutes before any meal, and before I take my hydrocortisone. And so I wake up half hour or so before, and then I do my vitals. I take the nausea pill. I write my vitals down. Then I take my hydrocortisone. Still unable to move or get anywhere, but I'm able to do my vitals. I do have hypoglycemia along with it.
So now you're having to
which is
check
my
your
sugar going up and down waves, and I have to check my sugar 4 times a day. So I check my sugar before I eat, and then 2 hours after I eat, and before I go to bed, and I have to have a snack before I go to bed, so I don't bottom out there. And
so it's still a learning process at this point, but you're
I'm learning
learning.
the symptoms,
Right.
and they are manageable.
And
There's
how
no
to manage
cure,
it,
but
yeah.
there is treatment for it. Now I can take 2 Tylenol for a regular headache. When I went into a severe crisis and dislocated my shoulder, 2 Tylenol, I'm golden.
And that's a big
had-
switch from what you were, like, with the pain you were having and the pain medicine, the Percocets, and
Yeah, and the one pain medication I was on also had a blood thinner in it.
yeah,
Tore it off.
which doesn't help.
So it was making things worse as well, and none of that was working.
Okay, well, I would like to thank you for your time with this interview, and we will, our next interview will be on adrenal insufficiency crisis.